2 weeks ago, a senior doctor who works at Lay's Angau Hospital added to the long list of health professionals who are pointing out the obvious.
We need drugs.
Dr. Lincoln Mender has served in the public health system for 36 years and is one of the most senior health professionals to speak out about the medicine shortages.
We are not able to provide. We are now prescribing, giving prescriptions to all our clients to buy it from the private sector. And we are passing the buck back.
His primary job, whenever there's money, is to visit the clinics all over the Moresby province and to treat and refer people with serious medical problems to the main hospitals. He hasn't been able to do his job well.
So many are dying from preventable illnesses that could be managed and prevented if we had the right drugs.
2 weeks ago, Dr. Mender was at the Milford Haven Clinic, one of 7 urban clinics facing a dire shortage of medicines and other supplies. In the clinic's dispensary, the shelves were at the time void of much-needed basic supplies. On the list provided by the officer in charge, he noted that antibiotics, painkillers, even anti-malarial drugs were in short supply. Dr. Mender wasn't the only one to speak out. Nurses who are at the front line of health service delivery also spoke out about the shortages.
Now make that run out. It's like
the situation has also taken a personal toll on health staff. Unable to handle patient numbers and unable to adequately treat those in need, one senior nurse broke down in the middle of an interview. Now, over the course of the month, the health department and the health minister didn't respond adequately to the concerns. And this was partly because those at the top of the health pyramid, the minister included, weren't well informed of the situation on the ground. And it took a week of intense media attention before the health minister finally responded with a statement, first outside of Parliament. The minister's statement came only after a shipment of drugs was sent to Lay a day before EMTV took these pictures at the area medical store in Lay. We were not allowed to film inside the area medical store. The store manager told us we had to get permission from the health secretary before any information could be released. They also wouldn't tell us when the shipment of medicines arrived. As nurses and medical professionals continued to speak out, and while much of the focus was on Lay, it was increasingly becoming obvious that the shortages were affecting nearly everyone, including members of Parliament.
I was struck down by malaria, and I tried to source anti-malarial drugs from both the district hospital and the provincial hospital, and unfortunately there were no drugs available to treat malaria.
So Pukatemu responded again, this time in Parliament.
I'm very, very happy actually as Minister for Health that the social media is informing me earlier and all the time, which is
The lengthy explanation also highlighted the fact that they wouldn't have known about it if the media had not highlighted it, and that poor internal communications, a shortage of manpower and theft were contributing factors to the medicine shortages.
In the media that the fact that the facility has run out of drugs doesn't mean that we have run out in the country.
Now, any serious journalist in Papua New Guinea seeking answers from the health department knows that it's quite difficult getting a response from the health secretary. Also, maybe, just maybe, it would help the public health system if a lot more members of Parliament actually used the public health system. Scott Waide, National EMTV News, Lay.